It's a couple days before Thanksgiving, 2019. We're here with patient Jeffrey, and the reason I wanted to do another interview with him is because I think that we can learn a lot from the kind of patient he was and why he did almost record healing when it comes to total first MPJ implant. In my 30-year career, I've really yet to see anybody heal this fast. Now, I scolded you.
You did.
And that was the day of the surgery, because I walked into his room, the hospital room, and he was sitting up like an infant, actually putting both toes, great toes, through a range of motion, testing it right away. That's just his personality. But that early range of motion is what heals him so quickly. You know, you hear online all these horror stories about bunion surgery, but the fact is if you do what he did, which is put yourself through early range of motion, in his case a little too early, but you end up getting your range of motion back, you don't swell up, and how much pain do you have?
None, hardly. I stopped taking the pain pills after a day.
So 1 day's worth of pain.
1 day worth of pain. And
never needed to do much walking around. And how long did it take you before you got into the tennis shoe for your right foot?
Oh, well, I probably broke the rules because I got in a little early. but after you,
just say
you know,
two
within
weeks.
2 weeks, I mean, as soon as I got the stitch out, I mean, I was in shoes, regular shoes. It's fine.
Okay, so it took him 2 weeks to get back into regular shoes after a first metatarsophalangeal joint replacement. His joint was destroyed. We basically repaired the entire joint and put a celastic implant in. This tells you a couple things. A, fusion. We talked about fusion.
Right,
You
want that.
You did not want that. Adamantly against it, because you are a very active 60-year-old. Okay.
Right.
So he's a very active 60-year-old. He did not want to have a fusion. In some other videos that you've seen on our channel, you've watched me interview a friend of mine who was a state wrestling champion in high school, get fused, break through his fusion. That's not what you want. You want a range of motion. So if we can come over here, I'm gonna just put this toe, which is what? How many weeks now?
This is 2 weeks from today.
Right. This is 2 weeks. Now, this is the one I reprimanded him on because he was literally flexing this toe less than 20 minutes after I did the procedure. I told him stop that and let the thing set in. But he's got a completely normal range of motion. He was completely rigid before, and we're going to take the stitches out now. And if you wouldn't mind, let's take a look at your other foot. Okay, so the right foot is how many?
So this is 5 weeks from today.
Okay, so go ahead and just flex your toe up and down. Okay, look at the amount of plantar flexion and dorsiflexion he has. It's just unbelievable. He had nothing before, absolutely nothing. Look at the amount of swelling he has. There's not a lot of swelling, if any,
No.
and the incision is already completely healed. He was back in tennis shoes in 2 weeks. So the moral of the story here is early range of motion and, you know, proper surgical technique, getting the implant to do what it's supposed to do, and consider preserving function. There's no reason to fuse a first metatarsal phalangeal joint if you don't need to. And the preservation of function, the fact that he's got some celastic in there, it's encapsulated, it's really not going to cause any harm, and he really needed it, and it's just so much better than metal in the body, in my opinion. So we'll do another, well, there's really no reason to because he's healed, but we'll probably see him in 3 or 4 months, and he'll be probably a rookie in the NFL. So.
Yeah.
Thank you very much. Great job. Okay, so tell me what you learned about this.
Well, one thing, I put this off for a while because I kept hearing all the horror stories from my friends and my family that, you know, you don't want to do this because it's so painful and the recovery's terrible. But, you know, this has been a great experience. I cannot believe how easy it's been, how pain-free, you know, limited pain, and my range of motion's back, and I'm excited about getting back and doing everything that I want to do, including my running, which I really enjoy. So
you're basically what's the distance that you?
I run 5 miles at a time, 3-4 times a week.
So we're going to interview him in about a year and just find out how these implants have held up with all the activity he's going to do. And we'll show you the x-rays, and thanks, Jeffrey.
Okay.
The truth about first metatarsal phalangeal joint destruction is it is progressive, but it gets to a point where it's self-limiting, meaning, yes, you can have breakdown of your joint, and ultimately that could lead to a natural fusion of the joint and being pain-free without any range of motion. That's not exactly the worst thing in the world to have if you've got this problem. So it's funny how nature has a way of taking care of itself, but there are better ways to handle the problem. And what I hope we did today is explain some of those ways. I hope you got a lot out of these videos, and I hope if you have any further questions, you'll contact my consulting page and allow me to consult you personally in a Skype consult and possibly help you understand a few of the important pearls regarding your particular foot, your foot structure, and what can be done to help your particular problem. I hope you got a lot out of this video series, and I'll see you next time. If you enjoyed this video series, please give me a thumbs up. And if you subscribe to my video channel, I promise you'll get more great information. Thank you.